In this video, we will be demonstrating the capabilities of our surgical planning software and its ability to import multiple imaging modalities, including fMRI and DTI data. We've been using the iPlan software by BrainLab for our surgical planning and navigation. We will use a clinical case of a low-grade glioma in proximity to Broca's area on the left. The tumor has already been contoured and is highlighted with orange color. And you can see the tumor in 3 dimensions as well. The software allows the importation of multiple imaging sequences, which are then fused together, and contoured objects can then be projected on multiple sequences. Next, we will demonstrate the use of fMRI data. After fMRI processing, the areas of activation can be converted to 3-dimensional objects, and here you can see in green the motor activation area and in blue the word generation activation area. These areas can then be projected on a coronal view, and you can see here the word generation area along the inferior and posterior aspect of the tumor. Next, we will demonstrate the use of tractography data. One useful MRI sequence for the generation of tracts is the fractional anisotropy map. This is a color-coded map where colors denote fiber direction, where green are the fibers which travel in an anterior-posterior direction, red are fibers traveling right to left or left to right, and blue are the projection fibers traveling from top to bottom. One or more regions of interest can then be placed on the MRI images, and 3-dimensional objects can be created of the generated tracts. Shown here in green are the motor tracts, purple is the optic radiation, and pink is the superior longitudinal fasciculus, which blends posteriorly with the arcuate fasciculus and inferiorly with the inferior longitudinal fasciculus. The tracts can be projected on the coronal view, which can be very helpful for preoperative planning. And next, the fMRI and DTI data can be imported at the same time. 3-dimensional view demonstrates overlap of the motor fMRI activation areas with the motor tracts, as well as the word generation fMRI activation areas with the superior longitudinal fasciculus as expected. And lastly, again, all these objects can be projected on the MRI sequences. Here we can see the coronal view, which again can be very helpful for preoperative planning.